Welcome everyone to the health insurance education series on Medicaid waivers. So this spring, this is our third webinar on a whole series dedicated to Medicaid waivers. So tonight we're going to be hearing from the Division of Developmental Disabilities on their waivers. And you can go back and listen to all of the other recordings on the DSCC website, and I'll show you that in the slides in just a moment. But we had in March and April, 2 other webinars about Medicaid waivers. All of the presentation materials are going to be presented in English tonight. If you want a Spanish copy of the slides, those are all on the DSCC website here under our Family Education webinar site. And that's where you'll find all of the presentation materials. The recording after tonight will be uploaded sometime in the next week. Any related resources get uploaded there as well. And then just a little bit about DSCC. So if you're not familiar with DSCC, we've been hosting this webinar series for a couple of years now, just as a way to get health insurance information directly to the community, to families, so that you can use that information directly. So our vision is that children and youth with special health care needs and their families will be the center of a seamless support system that improves the quality of their lives. And our mission is that we partner with Illinois families and communities to help children and youth with special health care needs connect to services and resources. So that's a big part of these webinars, to make sure that you all are getting connected directly to the information and to the resources. I am going to turn it over to our presenter for tonight from the Division of Developmental Disabilities, Linda. So Linda, I'm going to stop sharing and then I will let you share your slides and take over. Thank you so much.
Thank you. My name is Linda McCluskey. I am the Medicaid Waiver Unit Supervisor for the Division of Developmental Disabilities. A little bit of background about myself. I joined the state of Illinois about 6 months ago, right around September. And prior to joining the state as the Medicaid Waiver Unit Supervisor, I worked with a couple of nonprofit agencies that provided services to individuals with intellectual disabilities in a variety of Medicaid waiver programs along with ICFDDs. So I do have a lot of background and experience in the programs themselves that we're going to be talking about today. I will also say that I am aware that the DD Medicaid waiver programs are pretty expansive, and there's a lot of information for families to take in, to digest, and interpret. So I'm hoping the information that I'm going to share with you guys today will be helpful in wading through that information to help you find the resources that you need and to connect to our services if our services is what you determine is your best fit. So some of the things that I'm hoping to cover with you guys today is the general question of what is a waiver or a waiver program, the general eligibility requirements for the DDD waivers, how to apply for our waivers, the types of waivers that we under the division have available, and then the services that are available under each waiver. I also want to specifically mention that all of the information that I'm going to share with you tonight is very specific to the DDD waivers. So it's not going to be applicable in other operating waivers. So what I share with you today is not going to be transferable over to the DOORS waiver or to the DSCC waivers. It's going to be just towards our DDD waivers. So I'll start off with a simple question. What is a waiver? It is a very simple question with an answer that feels overly complicated. Per Section 1915 of the Social Security Act, a 1915C waiver is a Medicaid provision that allows states to offer home and community-based services to individuals who would otherwise require institutional level care. But what does that mean? What it means is that Illinois has asked CMS to use some of our designated Medicaid funds in a different kind of way. So in a Medicaid waiver program, the Medicaid restrictions that are usually in place are being waived and it allows the state to use those funds to cover things that Medicaid technically and usually wouldn't be covered for. And those are usually things like non-medical services. The great thing about these waiver programs is that states have flexibility in designing them, but we have to keep it within CMS guidelines. So we get a lot of choice to build a program the way we want it, but we just have to follow the CMS rules when we do that. One of the great things that lets it be flexible is that we can target a specific population of consumer, which is one of the reasons why you heard from different waivers previously. DSCC can target medically fragile individuals, while the DOORS waiver can target specific disabilities. Our waivers specifically target individuals with intellectual disabilities. This way we can tailor programs to what that person's need is, as opposed to just offering a spattering of things that might not fit for you. One of those big rules to keep in mind for Medicaid waivers is considered cost neutrality. This means that the average cost of services through a waiver program can't or shouldn't exceed an institutional type of setting like a hospital, a nursing home, or an ICFDD. We're essentially telling the federal government when we apply for one of these waivers that they're going to get more bang for their Medicaid buck if we get to spend it like this, as opposed to in a hospital or an institution. Another really important thing for families to realize is that waiver programs are not entitlement programs. What that means is even though your loved one might meet all of the requirements and eligibility points today, that does not mean that they are guaranteed waiver services. We have capacity and funding limitations, and there is often a wait list or a referral process for services. So once again, the waiver programs are not entitlements under Medicaid. They are allotted under specific circumstances. So there are 9 Medicaid waivers currently operating in the state of Illinois. DDD operates 3 of those waivers. We have the residential service waiver for children and young adults, the support waiver for children and young adults with developmental disabilities, and the adults with developmental disabilities waiver. Once I make it through the eligibility requirements, we are going to come back and we're going to go ahead and pick apart these waivers and cover what is in them. But first, let's go ahead and move into eligibility. So the eligibility requirements for our waivers are the same for all 3 of our waivers. To qualify for services, a participant has to meet the following criteria: 3 years of age or older if you're in the children's waiver, 18 or older if you're in the adult waiver. The participant needs to be a U.S. citizen or legal alien. They need to be a resident of Illinois residing in Illinois. And they also need to be enrolled in Medicaid or Medicaid eligible. If your household is over the Medicaid asset limit and you are seeking services for a minor child, we do not consider parental income when we assess a child's eligibility for the waiver. So unless your child is working or has a viable income source, it's not typically a concern. The participant cannot be in need of 24-hour nursing care or supervision. So if your loved one requires that level of nursing assessment or supervision, the DDD waivers are not going to be appropriate for that. And then the participant also needs to be determined or diagnosed with an intellectual disability or a related condition. And that last point is that targeted population standard that we're looking at, is that intellectual disability or a related condition. So to break down the diagnosis of intellectual disability that a participant should have, the diagnosis criteria is significantly sub-average general intellectual functioning, which is generally an IQ of 70 or below. It should be diagnosed by a licensed psychologist based on a formal assessment result, and it should display a deficit in adaptive behavior as present in that assessment. It's a fancy way of saying that there is some kind of limitation in that person's ability to do everyday things or communicate effectively for independent living. And intellectual disability can technically be diagnosed after the age of 18, but needs to manifest before the individual reaches 18 years of age. And that is very important for our intake criteria. So if your individual is not diagnosed with an intellectual disability by the time they are 18, they are going to need to seek credible evidence or some kind of physician result or assessment indicating that this was a potential diagnosis prior to the age of 18. If you feel that your loved one doesn't meet this diagnosis of intellectual disability, it's possible that they might still qualify based on a related condition. So a related condition is considered a severe chronic disability that meets all four of the following check marks. So the first, it's attributed to cerebral palsy or epilepsy or any other like condition other than a mental illness that is found to be closely related to intellectual disability or developmental disability because the condition results in impairment of general intellectual functioning or adaptive behavior similar to someone with IDDD and requires treatment similar to those for IDDD. I understand that's a mouthful. What it means is that they have a condition that is so closely related to intellectual disability that you would provide care for that person as if they had an intellectual disability. So the care would be similar. That related condition should manifest or be diagnosed before the age of 22. It is likely to continue indefinitely or for the rest of their life and results in substantial functional limitations in at least three of the following life areas. And those life areas are self-care, language, learning, mobility, self-direction, and/or the capacity for independent living. So I understand that can be a confusing topic or condition to kind of piece out. So if we look at a quick example over here, let's take John. John is 15 years old. He has a diagnosis of cerebral palsy, and he has some significant limitations in being able to take care of himself. He can't get around the house independently. He's nonverbal or he has limited functional communication skills, so he needs a lot of assistance to communicate. Based on what I see there, John could potentially qualify for our DD waiver based on a related condition criteria. If you think that based on the general eligibility requirements and that diagnosis criteria, your individual would technically qualify, the first thing you're going to do if you want to pursue DDD waiver services is you are going to find and contact your local independent service coordinator office or your ISC. They are assigned regionally, so it's going to be based on the county that you live in. Once you get into the Chicagoland area, it might be based on your zip code in certain areas, but we do have an online office locator available. If you get copies of the slides, these are all clickable links that you can follow. Otherwise, Googling or going onto the DHS DDD website will get you there too. You can also call the hotline listed, enter your zip code, and they'll connect you with the ISC office information. If you have no idea what an ISC is, that's okay. An ISC is a DDD contracted agency that serves as the primary connection between individuals and guardians who are seeking or receiving DDD services. So I would refer to them lovingly and have in the past as the keeper of the keys. They are the people who will assist with placing interested individuals on our PUNS list or the wait list for services. And they also provide a plethora of other services to our individuals. So they provide conflict-free case management services. So they are not endorsed, nor do they recommend specific services based on any type of connection. They are looking for what is in the best interest of the individuals. They are going to be the people responsible for conducting eligibility reviews, personal plan development. They also handle any appeals or complaints that you might have about the services that you have. And they're going to be the ones that are going to assist you in locating services and supports. Going back to that important piece of the ISC being the ones who would place your loved one on the PUNS list, the PUNS list is the DDD wait list for services. It is the database that registers individuals who want or need DDD waiver services. Now, some really important things to realize when it comes to the PUNS list, it is based on presumptive eligibility. That means when the ISC is placing your person on the PUNS list, they're assuming based on a very quick cursory screening that they are eligible. So they have not done a full assessment. They will not do that full assessment of eligibility until your person is selected from the PUNS list itself. There are two categories of waiting on the PUNS list. And it's really important when you contact and communicate with your ISC that you understand what the two categories mean. There is seeking services and there is planning for services. So seeking services means that you currently need or want supports. If I were to call tomorrow and say that you've been selected, you are ready to move forward with the process. Planning for services means that you want services in the future, but you're not necessarily ready yet. Actual selection from the PUNS list is usually based on a person's overall length of time spent in the seeking services category. So that's why I want to really stress that being in the right category on the wait list is important. If you spend 3 years planning for services and 1 year seeking services, you've only accumulated 1 year on the wait list. It's really important to be ready and to communicate with your ISC. Crisis situations and other designated groups are going to take priority when it comes to PUNS selection. And to elaborate a little bit more on that one, crisis situations typically include abuse, neglect, or homelessness, and designated groups that would take priority include DCFS youth that are about to age out of DCFS funded housing or class action members like Bogard. Individuals are selected from the PUNS list as funding becomes available. We try to poll in batches so that ISCs can be assigned those groups to work with, but it will happen as people move from the waiver or more funds are brought into the program. When your person is pulled from the PUNS list, they're pulled with a waiver already selected for them. So moving back to those 3 waivers, we have the Children and Young Adults Residential Waiver. This is a crisis selection only, which we'll talk a little bit more about when we break that waiver apart. But the Children and Young Adult Residential Waiver is for individuals from 3 to 21 years old. The Children and Young Adult Support Waiver is for 3 to 21 years old. And the Adults Waiver is 18 and older. Now, you've probably seen a little bit of overlap in those ages. So, children or young adults 18 to 21 can be selected for the children's waiver and or can stay in the children's waiver until their 22nd birthday. But it's possible that your young adult might be selected for the adult waiver as early as 18. Any children waiver participant is automatically granted adult waiver services. So once you, for lack of a better term, age out, you're going to automatically roll into the adult waiver services unless you decide that that's no longer what you want and you opt out. Families do need to plan transitioning into adult services no later than their 22nd birthday because that is the children's age out limit for our waiver. So we try to time that overlap with the public school system because we do understand that a lot of parents want to continue a lot of the education-based supports that are offered through the school system. And the children and young adult support waiver kind of gives you a little bit more flexibility to do that with. Once you are placed in a waiver, that ISC is going to contact you again, and they're going to help you create a person-centered plan. The person-centered plan drives all of the services for the consumer. The ISC is going to meet with the consumer and any relevant team members to determine any needed supports and services. And that person-centered plan is developed and then updated every single year. It should include things like progress tracking, who is responsible for providing certain services, and any outcome or goals that you have for your individual. Services should not be implemented without being added to that person-centered plan. So if your loved one has an IEP in the school system or some type of care plan, this is a very similar type of plan. So I understand that I already threw a lot of information at you, so I kind of wanted to briefly summarize for you guys what that process looks like. So once again, if you feel that your individual meets the eligibility criteria of the age and the Medicaid eligibility, and they have an intellectual disability or a related condition, you're going to contact your ISC, and they're going to create or complete a general eligibility review, and they're going to place your person on the PUNS list. The individual is selected from the PUNS list as the capacity becomes available, and then the ISC will complete the screening of eligibility. Assuming that your individual does meet all of the screening criteria during the full assessment, the ISC is going to then develop the personal plan, and your waiver services can begin. So now moving into our 3 waivers. Starting with the children's residential waiver, I feel like this is probably the clearest, most cut and dry waiver to describe. So we're going to kind of start off with this one. The children's residential waiver provides 24-hour residential supports to eligible children and young adults with developmental disabilities from age 3 to 21 who meet functional and financial eligibility. These supports are designed to prevent or delay the need for residential services in an ICFDD. So in the children's residential waiver, it's 24-hour residential care in a child group home. These group homes are licensed by DCFS, and they are overseen by the DDD. Once again, residential waiver placement is crisis placement only. This means that that child cannot be safely maintained in the family home for that period of time. The group home is staffed by direct support professionals that we call DSPs. There is nursing supports and medication management available. And there's also case management supports, behavioral supports, and educational supports to ensure that the school year or school system is not interrupted. Our next waiver is the Children and Young Adult Support Waiver. It provides services to eligible children and young adults who live at home with their families. This is often referred to as home-based supports and is designed to prevent or delay out-of-home residential services. So this program or this waiver works through a concept known as self-direction. Self-direction allows the consumers or their families to use employer authority to hire or terminate personal support workers and direct their service provision within the waiver. So a family is awarded a monthly budget or a service maximum that is typically 2 times the standard SSI income level. Families utilize that budget to select from a menu of service options that are available under the waiver. So to give you guys a snapshot, the current 2025 monthly budget in the children's waiver is $1,934, which is an annual maximum of $23,208. The children's support waiver is a flexible budget. It allows families to use the funds as they need throughout the year. So based on this concept, any unused funds are going to roll over to the next month, but you can't spend more than $3,868 in 1 month. That's your monthly max. At the end of the calendar year, any unused funds are not going to roll over. So if you have not used your budget by December 31st, it is gone come January 1st of the next year. That flexible budget allows families to spend more when they need it more. So if we're following the typical school year, as a mom, I'm going to need more support during the summer because my kids are not in school. So the same concept applies here, in which families can use and flex that money and put it where they need it. If the concept of self-direction or hiring your own personal support workers is overwhelming or something that you are not interested in, agency-based models are also available, but I would comment that a vast majority, upwards of 90% of our children's support waiver opts for the self-direction model. I think a lot of families choose the self-direction model because we do have Access. Access is our contracted fiscal management entity for Illinois. They assist self-directed families in hiring and paying their personal support workers, which you might also hear me refer to as a PSW. A personal support worker can be anyone that you designate as long as it's within waiver guidelines to provide personal care to the individual consumer. So it can be a relative, it can be a family friend, it can be the next door neighbor, it can be almost whoever you want it to be. And then Access is responsible for making sure that person is enrolled in Medicaid in the impact system, that background checks are run on that person. They maintain the payroll, including withholding taxes if applicable. And then they also maintain the EVV system for that PSW. I won't branch into EVV past this slide. It's a really fancy way of saying the PSW has to clock in and clock out on a live system that records the clock in and clock out. And that is a requirement in most of our programs. Do remember that Access is not the employer. In this type of a program, you are the employer. Access is being provided to you at no cost to ensure that the fiscal and legal requirements in place are being met. If you choose to utilize agency-based PSWs and those agency-based models, the provider agency is going to assume those payroll responsibilities, and they're going to bill us directly. You wouldn't require any of these Access services. So services that are available under the Children's Support Waiver include self-direction assistance. Self-direction assistants are available through agencies, and they work as case managers or assistants that help you navigate this overall system. They can help you find supports. They can help you with your timesheets for your personal support workers. They can help you stay in budget. There's also behavioral services and supports available. So if your individual needs any type of behavior-based therapy or board-certified behavior analyst services, that is available. Self-direction assistance and behavioral service and supports are based on a fee for service. So the division dictates an hourly rate that everyone across the board has to adhere to. That way you don't have to go shopping around. Everybody costs the same, and you can budget in what you want to pay for those services and how many hours a month you want for those. Personal support workers is another available service. So once again, if you're in the self-directed model, you get to hire that person and select that person. And we also have temporary assistance, also referred to as crisis supports, available. It does require prior DDD approval, but I always want to make sure that families are aware of this option. It is an additional support or budget in the event of an emergency absence of the primary unpaid caregiver. So if you are mom and heaven forbid you get into some type of accident that keeps you from being able to care for your child for a period of 60 days, it would give you extra budget money to hire or pay your current PSW to help fill in that gap. So that way that service gap is filled because we understand that you are unable to do what you would normally do for your loved one. There's also a series of award available underneath the CHBS services. Consumers should contact their ISC to request these awards or services because they are subject to DDD approval. It's a $15,000 maximum per customer per 5-year period for any combination of these awards. So if you need a ramp installed in your home and then 2 years later you need a full mechanical lift installed somewhere, the cumulative total of those two services can't exceed more than 15 grand in a 5-year period. If you rent a home, there is a 5,000 maximum per address for a permanent home modification in a rented home. So if you are someone who rents and you're not going to be at the same address within that 5-year period of time, we do have that cap on that modification in a rented home. These services do need to be completed or filled by a Medicaid-approved vendor or contractor. So once you are awarded those funds, you do need to use a Medicaid-approved vendor. It is relatively easy for a contractor or a vendor to become a Medicaid-approved vendor or contractor. So if you are working with someone that might be interested in doing that work for you, they can contact the division and we can help them get enrolled. Moving into the Adults with Developmental Disabilities waiver. The waiver for adults with developmental disabilities provides supports to eligible adults with developmental disabilities ages 18 and over. The supports provided are designed to prevent or delay out-of-home residential services for customers or to provide a residential service in the least restrictive community setting for customers who would otherwise need an ICFDD level of care. I would comment that because we don't have an age maximum, the adults waiver is our largest waiver. And it does offer a significant amount of services and supports. So there's a lot of variety in this waiver. So when we move into the adult waiver, customers are going to usually immediately need to choose between two primary support types, a residential support or a home-based support. Which one you choose is a personal choice based on what you need, and the participant can transition back and forth from one choice to another if circumstances change. So if your loved one decides to stay home with you a little bit longer and then realizes a few years down the road, gee, I really want to move out, residential supports is something that they can transition to as things change. So we'll start with the adult home-based service option. It is similar to the children's home-based program in layout, but once again, with more service options. The consumer or the designated employer of record is going to purchase supports with the monthly budget. The home-based consumer self-directs the services and exercises employer authority just like they would in that children's home-based program that I described. Adult consumers can receive these supports in their family's home, or they can receive these adult home-based services in their own home or apartment. So if they decide to move out or get their own apartment, maybe live next door, they can carry those home-based services and supports into their own home in order to kind of bridge that gap. The adult monthly service maximum budget is not flexible. It is use it or lose it. So that is a big difference between the children's home-based waiver and the adult home-based waiver service is that the children's flexes, it rolls over. The adult budget does not. Use it or lose it. If your individual is still attending school and is in the adult waiver, they're going to get the same monthly budget they would in the children's waiver. The 2 times Social Security income, which for 2025 is $1,934 a month. If they're no longer attending school, the monthly budget is 3 times the SSI income of that year. For 2025, we're looking at $2,901 a month. And once again, the consumer or the family member that is making the budget decisions is using that money to select from service options that are available. Some of the services that are available to adults in the home-based service program include self-direction assistance. So just like in the children's waiver, if your loved one needs a little bit of help managing their budget or finding services, they can purchase that. They can also hire a PSW. They can attend some type of day program, which is what community day services is. If they are competitively employed or want to be, we collaborate with DOORS to provide supported employment services, job coaching, and support. Once our individuals get into their senior years, we co-op with the Department of Aging and they can purchase adult day services. And then there's also behavioral services and supports. There's occupational and physical therapy available that go beyond what is in the Medicaid state plan. Counseling and therapy. Non-medical transportation. There are nursing services available. Temporary assistance or that crisis support, just like in the children's waiver, is available in the adult waiver, along with the same awards. So the Home and Vehicle Modification Award, the Adaptive Equipment and Assistive Technology Award, the monetary service limitations are going to be the same for the adults as it is in the children's waiver. So it's that $15,000 limit per 5 years per person. Anything marked with a star is going to require prior authorization, and all of these services are going to be on a fee-for-service scale. So once again, it is a set rate, and that is what you are able to budget for based on your monthly budget. Flipping over to the adult residential option, adult residential services are all agency-based supports. Community integrated living arrangements, or SILAs, is what these services are typically called or are going to fall under. They're supported in community-based group homes and individually controlled homes and apartments. A SILA's max capacity is 8 persons, but we typically see 4 or less in a SILA. These homes are licensed and regulated by DDD, and there are varying levels of supports and services available in a SILA. The consumer is still going to exercise their choice of supports and services, but they don't have a monthly budget anymore, and they don't self-direct their employer authority. So the agency themselves is the one that is ensuring employment and budget and things are being provided per that personal plan. Supports in a SILA are going to include adaptive skill development, community inclusion, adult education support, social leisure skills, personal care, behavior management, and nursing assessment, amongst a host of other things. There are a variety of different types of SILAs or residential options. So there are a total of 3. The first is going to be a 24-hour SILA. This is what most people think of when they think of a residential support option. It is a group home. They have on-site shift staff 24/7. At any time an individual is present or home, a staff member is there. Those staff provide scheduled and unscheduled supports and services as needed by the individuals. So that's going to include daily living skills, basic hygiene assistance, meal cooking, medication management, whatever the individual needs, the staff are on site to meet that need. Another 24-hour SILA option is a host home SILA. A host home consists of 1 or more persons who are unrelated to that individual and are under contract with a provider agency to provide those services. No more than 2 individuals can reside in a single host family. I sometimes will equate a host home concept, if you're unfamiliar with it, to almost a foreign exchange student. You open your home to someone to come live with you for a designated period of time, and you are responsible for the care of that person while you're under contract. And that's essentially how a host home works. So there are 2 different support models. There's a standard host family and a comprehensive host family. I won't read the details for you. Essentially what it means is a standard host family is a standard family home. The family that lives there on a full-time basis is providing almost all of the care for that person. Whereas the comprehensive host family, the individuals who live in the home are not providing more than 50% of the care, and then agency-based shift staff are coming in to fill the rest of that time. The third SILA option is going to be called intermittent SILA. They typically serve individuals whose personal plan documents that they don't need 24-hour on-site staff presence. So the personal plan would say, this is when the individual needs assistance, or these are the times that the individual needs assistance, and that's when staff would be on site to help. Intermittent SILA, also referred to as ISILA, can be provided in an agency-controlled home or an individually controlled home. Intermittent residential services in apartments or family homes have staff available on call 24 hours a day. Those on-call staff are available to provide both scheduled and unscheduled supports and services as needed and as specified in each individual's personal plan. So if someone requires intermittent SILA services and their personal plan dictates that they need assistance from maybe 3 until 9 o'clock just to get home from work, take their medicine, help with dinner prep, maybe get breakfast put in the fridge, that's when staff would be there to assist. And if anything else came up in the meantime, there would be a staff person on call for any emergent situations. Residential services are going to include direct support professionals, very similar to the child group home concept, with nursing oversight and assessment. Residential services also includes participation in a day program or a vocational opportunity. So they get the same options as the home-based adults for day program or adult day services or supported employment. They also have access to behavioral supports, case management services through a QIDP, agency-based transportation, STAT services. That is one of our newest SILA options. It is a specialty telehealth service. They also have access to therapy and counseling and the same type of awards that the home-based individuals have. So once again, assistive technology, adaptive equipment, and home modification awards. They also have access to occupational, physical, and speech therapies based on prior authorization. So there are some general sweeping waiver service limitations that I do want to throw out there before I wrap up. Things to remember is that individuals can only participate in one 1915C waiver at a time. So if your individual is actively participating in another waiver, they can sign up and be on the PUNS list. Once selected from the PUNS list, we actually have a person within the waiver unit that will assist the other waiver agency with coordinating the changeover in service. So you can't have both waivers at the same time, but we will transition you guys as smoothly as possible from one waiver to another. When it comes to PSW services, they cannot be rendered by a legally responsible adult if the consumer is under 18 years of age. Legally responsible in our waiver means typically a biological or adoptive parent that is responsible to provide care by law for a minor child. So if dad wants to be the PSW for his 16-year-old son, that would not be allowed under any of our waivers. Once the person turns 18 years of age, then a parent or legally responsible person could potentially become the PSW. A PSW has to undergo required background checks prior to hire and annually. There is absolutely no exception for family members or parents. So every single person has to do the background every year, and that needs to be a clear background. Waiver services can't be rendered at the school or for the benefit of the school. And then adaptive equipment or those assistive technology awards, we can't use waiver funds if it's something that would be covered under the state Medicaid plan. So if your state Medicaid plan pays or would pay for a piece of equipment, then we have to allow that Medicaid plan to do that. We cannot utilize waiver funds. If that piece of equipment or that technology piece were to be denied or you're not eligible under the Medicaid plan, that's something that you could use waiver funds for. So once again, if you guys have or request a copy of these slides, these are all clickable resource links that are going to bring you directly to the DDD pages of some of the information that I mentioned. We do have a consumer handbook for home-based service families. It is very helpful, very plain language that will walk you through a lot of the program and a lot of the responsibilities. There's also my contact information and the general inquiry inbox for the division as well.
Thank you, Linda. Would you prefer that questions after today go to that general inbox?
Any of them that they have from today that they might think of later, they are welcome to send directly to me. If you think it might be a little bit more of an expansive question, you guys are more than welcome to use the general inquiry inbox. It is manned by someone who helps decide the right person to send it to. So sometimes that is me.
Okay. No, I think I'm gonna just finish out the last couple of slides that I have, just in case anyone can't stay on. And then, depending on what time you have, Linda, we can go to some questions. There's a few in the Q&A, if you want to take a look at those while I'm kind of sharing my last few bits here. Okay, so for anyone that is not able to hang on with us past a few minutes past 7, I wanted to say thank you to all of you for tuning in today. Thank you to Linda as well for presenting all this great information. I know that a lot of people found it helpful. Thank you to our interpreter for making this accessible to our Spanish-speaking families. Again, all the materials, the slides, the recordings, they're all going to be posted on the DSCC website here. And then the last thing I wanted to talk about is the future webinars, which there are actually no future webinars about this health insurance series. This is the last one for this kind of spring series that we do. We'll bring it back in 2026. But there are an additional couple of webinars that might be of interest to this group that are about preparing for adulthood. So if you go on that same website, the Family Education Webinar website that I have the link for, there's going to be one in June and one in July, and you can register for those now. So that might be something just to look at and see if there might be topics that are helpful for you. So that's what I've got here. And again, our contact information if you should need it. But I definitely think that Linda and the folks at DD are going to be much more helpful on their waivers than we would be. But if anyone should have any general questions, do feel free to get them to DSCC and we can certainly point you in the right direction as well. Okay. So Linda, I guess there was a few questions I saw coming in. So I'm not sure how specific they were, but I'll defer to you on what we might be able to tackle tonight in the last maybe few minutes here.
Yeah, I will do my best to go ahead and answer some of these. They seem like very straightforward questions. So the first one that I see is that someone is saying that their daughter has a syndrome and asking if she qualifies for DDD since she is delayed and everything. That is something that the ISC is going to help you determine. But if that syndrome creates a situation that's going to mock or be like IDDD, then she's most likely going to be qualified under a related condition. Will early intervention coordinators at the age of 3, when the child ages out, make a referral to the ISC, or is the parent responsible? You guys, as the family, are responsible for reaching out to the ISC. It is a very direct process. So there is no professional referral. It is just your contact and your outreach to them. If a young adult is diagnosed at a young age with autism, who also develops severe anxiety, but recently tested at an IQ at 89 at age 20, would this be considered eligible? Typically, yes, because autism is generally considered a related condition. It's going to really then depend on those functional limitation criteria. So if that person struggles in at least 3 of those 6 life categories, potentially they could qualify. Is the child's IEP good enough for eligibility? Or do you need to find your own clinical psychologist? It's going to depend on how detailed that IEP is with diagnosis and suggestions. I would reach out to your local ISC agent to see what they think is enough, or even to see if your child's existing IEP would be sufficient. Can a family member or relative that doesn't have a legal status, can they qualify to be paid while taking care of a child? Unfortunately, the person who is hired as a PSW has to be qualified to work legally in the state of Illinois. All right, the average wait time on the PUNS list for children. So the average wait time for seeking services, they have it in months. Forgive me, I don't remember the exact number of months, but it averages 3 to 4 years for wait time overall. Once selected, is there a time limit on how long you can have the waiver? Nope. A lot of people have it until, I mean, for lack of a better word, they die happily in their beds of old age. So there is no max limit or length of time for the waiver. Okay, the next one refers to private insurance and Medicaid, asking about if the family needs to be on Medicaid or keep their private insurance. You don't have to have Medicaid at the time you're selected. The individual has to be Medicaid eligible. So if you're talking specifically for a minor child, if that child by themselves, removing mom and dad's income, is eligible for Medicaid, that's usually not much of an issue. So you don't need to worry about that. Okay, let's see. So the ISC, just to kind of refresh, is the Independent Service Coordinator. We contract with them to provide case management. So they are an entity that works for us for DDD, and then DSCC is going to be a separate division. The future of these waivers, great question. So our waivers are allotted in chunks of time that are renewable. So right now our waivers are okay for several years. Obviously, Medicaid cuts keep us from being able to expand. But the base of the program is relatively safe because remember, we're a cheaper option than any of the other options out there for these type of programs. See. So when on the puns, you want to say that you're seeking services. Yeah, if you're looking for services right now, you want to make sure that you're on the list as seeking services, because if you're just planning, they're not going to be looking at you. Okay. And then I don't think I'm going to be able to answer the difference between puns, DSCC, DOORS, or DHS. It's a lot of letters, I get it. So DHS is the operating agency for Medicaid. DDD is the Division of Developmental Disabilities. That's who I work for, and PUNS is our wait list. DSCC and DOORS are going to be other operating agencies. All right, did I miss anybody? Okay, I saw somebody on the chat. Do we apply on ABE or a different website? If you're talking about for the waiver program, you're going to call your ISC office. You're going to let them know that you would like to put your individual on the PUNS list. Someone asked if they're or if this would relate to their 13-year-old. Absolutely. He's going to fall under that children's waiver. And then I saw one other question in the chat. If you are awarded the children's waiver 2 times SSI, do you have to wait to be awarded the adult waiver, or are you automatically moved? So I use the word automatically loosely because there is paperwork, but you are automatically granted access to the adult waiver as early as 18, but you have to transition by the time you're 22. So if you decide you want to bump up at 18 years, you can do that. You just have to contact your ISC. Okay. And then one other question came through. My son has a physical med and rehab doctor for his cerebral palsy. Does PUNS or waiver need documentation from them? Typically, they will need them, and you can talk to the ISC about when they will need them, if they want them for that cursory eligibility review or if they'll want them for the full eligibility review. Two
Well,
and a half year old qualified, nope, three and up.
that was
So you
an
got to
easy
wait
one
until
at
your child
least.
turns three.
Okay, so we'll call it there. If there are any other questions, of course, everyone feel free to reach out and anyone will get you in the right direction to get your question answered. Again, Linda, thank you so much. Thank you to all of you for being here tonight. And we'll look forward to seeing you on the next webinar.